Good afternoon, everyone. Thank you for inviting me today to join this discussion about diversity in research. I'm Vicki McGowan from Newcastle University, and I'm going to be talking about the Equal England Public Network, which was set up to increase public engagement and involvement in health and equality research. So, first of all, I'd just like to give a bit of background to the development of the public network. I'm sure many of you are aware that life expectancy across the north of England is consistently lower than the English average. So Public Health England commissioned an independent inquiry to investigate health inequality in the north. And the inquiry published the Due North report in 2014 with these 4 key recommendations for achieving health equity across and within the north. And I think number 3 here is particularly relevant for today's seminar, and for me at least highlights one of the more fundamental reasons for us to ensure diversity in our research. By sharing power and influence over resources, we're actually embedding an equity approach into the work that we do and actively working to reduce inequalities. So as a result of this report, the Equal North Research and Practice Network was developed by academics across the North, and some of you may be members of the network yourself and receive regular emails from myself. The network is initially funded by Public Health England, and it was to take forward the Due North agenda and some of the recommendations by building a community of shared interests in achieving social and health equity. The network hosted a series of events across the region to facilitate new collaborations, disseminate evidence to policy and practice, but also undertaking a priority setting exercise within these events to identify research priorities for achieving health equity across the area. The priority setting aimed to understand what areas research should focus on to address health inequalities across this area. And around 250 academics, policymakers and practitioners contributed to workshops at Equal North events and a survey exercise to identify research priorities to address social and health inequalities. Findings highlighted that research should be prioritised in areas that focus on the structural determinants of health, concerning areas such as poverty, austerity and unemployment. But was something missing? Was that the whole story? Well, we only had one side of the story, and it was an important part nonetheless, but it wasn't the whole story. And I'm sure that many members of the public would agree that poverty, austerity and unemployment were indeed priority topics, but we needed their perspectives to ensure that we're developing research that addresses these drivers of inequality and doesn't widen them further. But also, we were talking about tackling inequality, but not including everyone in the discussion. So we needed to replicate the priority setting work with members of the public with lived experience of these issues in order to address inequalities across our region. So when Equal North expanded to become Equal England, this was an opportunity to open access to members of the public. NIHR, SPHR funded the expansion of Equal North across the country, which increased our practitioner membership to over 800, and the planned dissemination events, knowledge exchange and research on the priority areas was going to continue under the new banner of Equal England. But this time we were expanding in other ways too. This time we were not just increasing our professional membership, but also ensuring that we could take forward the Due North recommendation to increase the influence that the public has on how resources are used. We needed to embed this equity approach from the outset and work with members of the public to understand their priority areas and co-develop research that is rooted in lived experience. So the Equal England Public Network was born, at least the idea was anyway. At that point, we were actually making huge assumptions that members of the public would want to work with us. But off I went anyway. Following the practitioner model developed in Equal North, we aim to create space for members of the public to share lived experiences and influence the work that we do and undertake some public priority setting exercises and see how these align with the Equal North work. We'd also share information about key events, new evidence, and generally keep people updated with health and equalities research as we do with the practitioner network. So the idea and the model was there. We just need the people. So how do we do that? One option could be to contact the many public and patient and public involvement groups that already exist. Why reinvent the wheel? But what if that wheel only comes in one particular style and it doesn't quite fit my bike? I was concerned that these established groups might not accurately represent the diversity we see in our communities. But also, these can be quite established groups that, by their tenure, already have the confidence and capacity to exert influence on research agendas. And I want to make sure that we had representation from people who don't usually have their voices heard in the communities that are affected by the priority areas that have been identified through Equal North. poverty, austerity, unemployment. But why is this diversity important? Oh, why is it important for us to go out beyond what's already there, beyond these existing PPI groups? So we know that only using one side of the story can be a problem. But there's also a need for diversity among the stories that we work with. If we're only including one group of people, then we're only seeing one part of the puzzle and perhaps focus our research agenda on the wrong things. So I want to ensure we can see the whole elephant and really understand how we address health and social inequalities, but also sense check whether the priorities that have been set by our professional colleagues reflected the needs of people with lived experience in this issue. So the grand plan. We're going to pilot this work in the North East, mainly because that's where I'm based, but also this is building on the Equal North findings. So we're going to implement this across 3 phases. Phase 1 aimed to connect with local grassroots that were embedded in their communities, promote the network at relevant community events, generally get out into communities across the North East and get to know people, develop trust and sign them up to our mailing list. After around 6 months of this relationship building, during phase 2, I'd invite people along to a series of local conversations where we'd present the findings of the Equal North priority setting and discuss whether people thought these were important for their communities, whether there were other priorities and what we needed to do to address them. And phase 3 would then focus on co-developing research proposals around these priorities and dissemination activities with academics and practitioners, making sure that public experiences were disseminated widely and incorporated into future planning, but also recognising that this wouldn't be a linear process. There would be definitely overlap across these phases. So that was the plan, and this is an idea of the reality. Do you remember 2019? Now, first of all, I need to acknowledge that I started off in quite a privileged position, as most of my research to date has involved working with various grassroots community groups. So this is where I started. When I was visiting groups as part of my research, I would talk to them about the network and what we hope to achieve. And phase 1 was very much about boots on the ground. This wasn't about sending some emails to recruit people to the network. This was about going out to people, using existing connections, developing new relationships with local people. But this also required some give. I had to give something back. So I'd make a conversation about what this network can offer, but also ask what do your community groups need if they need anything. And one group wanted some support around evaluating complex projects, so I held a workshop for them in their community and used this as an opportunity to promote the network again with new people. And we got around 15 people signed up for this first event. And this giving back provided further opportunities for promotion because I was then invited to help facilitate community events and present findings from some of our research projects. And it was this face-to-face work that was vital in developing these new relationships. People started seeing me at events quite regularly and got to know me. Visiting groups with no prior relationships was a little bit harder. People were wary. One group told me how they'd been consulted to death by their local council and that nothing ever changed. So I was mindful that I needed to be clear that what the network could offer and hoped to achieve, but not promise room on a stick and then not be able to deliver that. So by February, I had some new connections. We planned a market stall where we're going to go to a local town centre and engage with new people, and another community event to develop phase 1 further. Exciting times. So by February, I felt a little bit like the littlest Torbo, with all this travelling around, and I'm probably showing my age with that reference. But was all this effort worth it? We had around 35 people who'd signed up to be official network members by this point. However, those 35 represented more people in their community. And I think this highlights a key point. You can't be the trusted person in the community straight away, maybe if ever, but you need to identify those who are and work with them. So we had 35 key community people officially on the books who represented a much wider community. But who do they represent, and was this a diverse group? Well, from this map, you can see how far my travels got me across the North East, and each one of these pins represents a connection to quite a variety of groups who are embedded in their communities. So we've got geographical diversity here forming from minor villages in Bishop Auckland across the deindustrialised Teesside. We've got rural and urban areas and some coastal towns. But what about within these diverse communities? Yes, we've got diversity between them, between these regions, but there's also a need to seek diversity within. So yes, we've got that geographical diversity, but we also have connections with Black and ethnic minority groups, LGBT plus groups, churches, faith organisations, groups that represent people living with severe economic disadvantage. And also within those groups, we've got representation from quite a broad age range and also representation from disability groups. So in terms of building a diverse network, I don't think we've done too badly by February 2020. March was going to be great. We're going to build this network. We're going to start setting up affairs for phase 2 local conversations, and we'd use these trusted connections to invite really diverse audience to our local conversations and priority setting phases. All going great. And then you all know what happens next. So phase 1 was lockdown. After 4 months of slowly building these relationships with new groups, promoting the network among existing groups, we get shut down. Obviously, COVID means that all planned face-to-face events were cancelled. Otherwise, everything that I was doing, the country shuts down. The vast majority of people I'd engaged with over the past 4 months are now focused on supporting their communities through crisis. People are furloughed, so they volunteer at food banks. People lose their jobs. They lose loved ones to the virus. The grassroots level is not interested in me trying to encourage them online to talk about inequalities that existed the virus and are now being made worse. The public network gets locked down and we pause activity, but thinking it won't be long before we're back chatting over coffee at our coffee morning. Well, I think our coffees are well and truly cold, as by late 2020, we're still not able to get together face to face. All is not lost. Rather than attempting to grow the network, I go into maintenance mode. It doesn't seem right to try and recruit more members during a time of crisis, so I keep in touch via the mailing list and share opportunities as they arise. Online seminars, opportunities to participate in and develop research. But actually, we did grow because our members represent wider groups within their communities. They shared my emails and we added a further 6 people to the network. It's not huge numbers, but given we're living through a pandemic, I was really pleased to see that new people wanted to engage with us. So we now have 41 official members who've been supporting and influencing the work that we do. But also they're sharing these opportunities more widely, which I think shows the power of working with key trusted members of the community. Amazingly, during the pandemic, we've had members of our network support the development of several inequalities projects, contribute to COVID-related research, and they've also helped shape the ARC national priority funding around inequalities and prevention. So although some of our activities are on pause, we've provided access to influence health inequalities research even during the pandemic. But we still have temporary restrictions in place preventing phase 2. And due to the restrictions, I can't visit local groups and we can't hold the local conversations to further the priority setting work. Everybody knows face-to-face sessions have been severely restricted, and even when they might have been possible at some point last year during the tier system, many members of the network are rightly prioritising their local community during crisis. So phase 2 face-to-face activities are obviously not possible now. But many community groups are actually online and using Zoom, so should we just move phase 2 online? Well, there are advantages and disadvantages to moving online. This might be an option for some, and many communities are using online activities, holding formal meetings and coffee mornings. So engagement is still possible, and it's also safe during the pandemic. And it reduces the travelling costs and our fees like a little as forward. But this isn't an equal activity, and the digital divide was a problem before COVID, and the pandemic has actually exacerbated it, with people now being expected to do everything online. Plus, the cost of moving online is a serious barrier for some, not only due to a lack of equipment, but finances to pay for increased internet, electricity. These can prohibit some people from taking part online. And for those fortunate enough to get online, Zoom fatigue is a serious issue. We need to consider whether the activities we want to do are proportionate to the costs for everyone involved, be that physical, financial, or even mental. So for us, the phase 2 local conversations are still on pause until we can hold these in person. But currently, many of the people involved in our network are very busy supporting their local communities in crisis. And now is not the right time for us to be adding extra work to their workload. But what can we do in a disconnected time to increase diversity in research and practice where activities can't be paused? I seem like a broken record here, but I identify and work with members of the community and known and trusted. While we're unable to directly connect with members in the community, we can connect with these key individuals that already have that relationship, who are trusted and connect as a liaison with the wider community. Also ask how people would like to engage. What tools would they like to use? Online sessions like these aren't for everyone. I'm doing a focus group soon with a group of young people via WhatsApp because that's what they wanted. Resources: not everyone can afford access to the internet or mobile data to spend a few hours online. But to ensure equality to access, you need to provide them with the tools to actually do that, if they want to. That also includes training. Some of the community groups that I work with have managed to get some very digitally excluded people online through very patient training of the phone. But this doesn't work for everyone. And some people will still not come online, even with all the resources and training provided. So don't push, just use old school methods like the post or phone, but also consider waiting. While this might be your priority right now, it might not be the same for the community. So some might wish to engage more when some level of normality returns. So finally, just some key points, I think, from me that I think are vital in terms of increasing diversity in our research. I'll say it again, engage with your existing networks, but identify people who are already trusting their community. These people are probably the most important, whether they're in a COVID world or a non-COVID world. Find them and work with them. Also, don't assume that diversity in groups will come to you. You must actively connect with groups and organisations that promote equality. Remember the elephant, we need those different perspectives. Boots on the ground. Don't assume an email or a post on Facebook will reach a diverse audience. Go to the people, identify social spaces such as community events, coffee shops, meet a natter group, talk to people about your work, but there's also ways of doing that during COVID as well. I would also say always give something back. Find out what will be useful to them. I've given some suggestions here, maybe that's payment or training opportunities. It could be skill sharing. And when I say skill sharing, I don't always mean that assuming we have the skills that they want. The community groups might have to share their skills with us. I've also mentioned access to university resources. I know that in some cases community groups have asked for this and universities have obliged. And this helps develop a reciprocal relationship, so it's not all about us taking from people. I'd also say be patient. Do not underestimate how long it can take to establish a meaningful relationship. I've been working with some of my community groups for 6 years. But if you don't have 6 years, then at least manage expectations. Be honest with people that your work might be time sensitive and clearly articulate what you need and how people will be reimbursed if they're able to help you. And that's everything for me. I just want to say thank you to all of our public network members for even supporting us and helping us improve health inequalities research even during